Hello everyone, my name is Ross. I'm a nursing student at ECPA University, and today I'm going to be talking about my project, which is about peripheral intravenous catheter sites. Policies and guidelines are a fundamental part of any healthcare facility. They help to establish a way to perform tasks in a systematic manner and improve patient care. Working as a nurse in a medical surgical unit at Biomolecular Hospital gave me the idea to analyze the compliance with policies, especially the change of peripheral venous catheter sites. Therefore, I created a project with the goal to design, implement, and evaluate an educational program to improve nurse compliance in changing peripheral venous catheter sites for the prevention of complications in patients. For the development of this project, I did a literature review, a comparison between the US and the MIH policies. I collected data before and after the in-service, and I analyzed the data. I consulted 10 articles. They all arrived to similar conclusions, therefore I picked this article by Su et al. As an example for this presentation. Su et al. Conducted a cluster randomized trial in a teaching hospital in Xiamen, China in 2013. They had two randomly divided groups. At the end, the study resulted in that there were no significant differences in the frequency of catheter occlusion, phlebitis, and infiltration. No infections were developed. All articles reviewed pointed out that peripheral IVs should be changed when clinically indicated instead of routinely. There aren't any proven advantages from changing the peripheral IVs frequently, and there can be some potential disadvantages. Additionally, this can potentially help to save more money and increase patient satisfaction. Let's now do a comparison between the US and the MIH policies. According to the Center for Disease Control and Prevention, the latest guidelines strongly recommend to not replace the peripheral intravenous catheters more often than every 72 to 96 hours in order to reduce the incidence of phlebitis and infection in adults. Also, so far, they don't make any recommendation regarding the replacement of the peripheral intravenous catheters simply when clinically indicated, which is something that they are still doing research for. On the other hand, the MIH policies says that we need to change the peripheral venous catheter sites every 96 hours. And if the peripheral IVs was placed in an emergency situation, we need to remove it as soon as possible in less than 24 hours of the insertion. Therefore, the facility use policy is almost the same in comparison with the CDC guidelines. At the same time, I think that this statement from the CDC does not provide a strong recommendation. In the implementation of this project, I was collecting data about how often the nurses were changing the peripheral IV sites in the unit during 1 week. The outcomes were that on the first week of the data collection, from a total of 121 patients, 19% of the patients had their peripheral IV for more than 96 hours, and 81% had them for less than 96 hours. This proved that some nurses were not being compliant with the hospital policies, which state that the peripheral IV sites needed to be changed every 72 to 96 hours routinely. In the data, we can see that some patients had their peripheral IV for more than 6 days, including one patient that had the peripheral IV for 10 days, which can produce more complications for the patients. Also, I encountered some nurses that didn't even know for how many days the patient had the peripheral IVs. Then I created and gave a PowerPoint presentation about the peripheral IVs and the MIH policy regarding the changing of the peripheral IV sites. The PowerPoint presentation that was given helped to inform and refresh the knowledge about the peripheral IV policy, and it created a lot of discussion among the nursing staff. Lastly, I collected data after the in-service for 2 weeks to see if there was any improvement in the compliance of the peripheral IV site change. The collation of the data during the 2 weeks after the in-service showed that 94% of the patients had the peripheral IV for a time less than or equal to 96 hours, and 6% had them for less than 96 hours. I think that this was influenced by the in-service that was given, but also due to the fact that there were many new admissions to the unit during those weeks. I think that one suggestion to improve the current peripheral IV policy at the MIH would be to make mandatory to pass the information of how many days the patient had the peripheral IV in the change of the shift report among the nurses, with the purpose of increasing awareness of the necessity to change the peripheral IV sites every 96 hours. In conclusions, peripheral IVs are commonly used in the healthcare system, and it is fundamental to follow the guidelines to decrease the number of complications. The creation of different alternatives to teach or refresh the institution guidelines is very important to help the staff members to know and be more compliant with the policies. This project helped to increase the compliance in the change of the peripheral IV sites in the unit. For the creation of this PowerPoint presentation, I used the following references. Thank you for your attention.